Namaste and welcome to Dr. Shah's clinic. My name is Dr. Shah and I primarily specialize in male infertility and sexual health. In this video, we are going to answer a question that many of my patients have asked me in the past couple of days, and that the question is, what are the signs of male infertility, or what are the symptoms of male infertility, and what are the things that you should look out for when a clinical suspicion of male infertility should be made. So what are the signs of male infertility, or what are the male infertility symptoms? Now, this is a very common question that I get from my patients, and let me get to the answer straight away. The first thing that you should know is that if you have tried for a child for the better part of 1 year or maybe 2 years, and you have had regular sexual intercourse with your partner or your wife, and if a pregnancy has not happened, then you should probably suspect male infertility or male factor subfertility. And this definition, to some extent is fundamentally flawed, because many people think that if a child is not born within the first year of marriage, people worry and then they go running to the fertility clinic for an evaluation. The thing to bear in mind here is that many pregnancies also happen in the second year of marriage, and some pregnancies do happen in the third year of marriage. But if there's a prolonged duration of time, say there's more than 2 years or more than 3 years, that a pregnancy has not happened, I would suggest it would be wise that you get yourself checked up with a basic semen analysis or a sperm test, just to rule out male factor infertility. So that's the first sign or symptom of male infertility, where you have tried for a period of time, no child is happening, so you have to rule out male factor infertility. The second symptom that gives the clinician a suspicion of male infertility is erectile dysfunction. So sometimes patients can suffer from hypogonadotrophic hypogonadism. This is a particular condition in which FSH and LH secretion is very, very low. There's no testosterone in the body, and these patients usually have severe erectile dysfunction. They are obese, they are tall, they have sparse hair distribution, and if you have erectile dysfunction and severe erectile dysfunction, regardless of the type of sexual stimulation, and you have no other comorbid illnesses, then that's another symptom that you have to watch out for. So erectile dysfunction is usually a good marker of male factor infertility, because to some extent it indicates that it's a two-way thing, because one, to some extent, if you don't get a good erection, you cannot penetrate, you cannot deposit sperms in the vagina, and that itself is a direct proximate cause of male infertility. The other thing is, to some extent, the male's erection correlates with the amount of testosterone in the body. So there is some degree of correlation between the amount of testosterone that the man is producing as well as his quality of erection. So to some extent, if you have erectile dysfunction, it also indicates that to some extent there is testosterone deficiency in the body. And not just that, erectile dysfunction itself is a marker of coronary artery disease as well as diabetes, and also in some patients with systemic hypertension, you can see ED. So erectile dysfunction is a marker of many health states, and more so for male factor infertility, as well as sexual dysfunction leading to male factor infertility. So that's the second symptom or sign of male infertility. Now the third sign and symptom of male infertility is testicular size. So if you have a testis that's very small, that is very soft, a peanut size shape, or somewhere in the range of 1 cc to 2 cc, you do a self-check of your testis size, see it's very small, oddly small in shape and size, then again we suspect testicular failure. It could be Klinefelter syndrome, it could also be hypogonadotrophic hypogonadism. That's another sign to definitely watch out for. The fourth sign that could be a sign of male infertility is a very small penis. So some patients have true micropenis, some patients have buried penis. There's a difference between micropenis, buried penis, and small penis. All said and done, a very small penis, again we have to rule out Klinefelter syndrome or hypogonadotrophic hypogonadism or other androgenization problems, and that's another sign of male factor infertility that should be borne in mind. The next symptom that you should definitely look out for is very low semen volume. So say you have a good erection, right? You have a proper organ size, your testis size is normal, but on ejaculation you see only 1 or 2 drops of semen coming out. That's a major sign of male infertility or male factor subfertility, because what's basically happening is semen is not coming out. That means that either there's a blockage somewhere in the male reproductive system, or semen is going backward into the urinary bladder. In this case, it's called retrograde ejaculation, and that requires its own specific management. So very low semen volume or very low quantity of semen itself is a sign of male factor infertility or male infertility. That's something you have to watch out for. And then other signs of male fertility include very low mood, very low libido, low sex interest, And you could also say some other signs like a lack of hair distribution, lack of male pattern of hair. So if you don't have a lot of hair in your bird area, and you don't have adequate hair under the arm, you're obese and you are very tall, and you see a female pattern of fat distribution in the body. These are all specific signs of male infertility that you should definitely watch out for. And these are all signs. It's important to understand that for so up to about 30% of patients, maybe about 30 to 40% of patients, there won't be any sign or symptom at all. Most of them will be very, very healthy. But then you do a semen analysis, and when you look at the semen analysis, what you tend to see, is that the counts are very low, the motility is very low. Some patients, everything looks absolutely normal, yet there are no sperms in the semen. A clinical condition called azoospermia has to be ruled out here. And we have to differentiate between obstructive azo versus non-obstructive azoospermia. That's a topic for another day. So common signs and symptoms of male infertility, to summate it up again. So a lack of erection, low sex interest, extremely low semen volume, extremely high degree of obesity, very, very small penis, very, very small testis, a lack of male pattern of hair distribution, female body fat, body habitus or female type of body fat distribution. These are all some signs of male infertility. And of course, the most important sign is you have tried for about a year or so, maybe more than a year, and I think you should keep it as 2 years or 3 years. Absolutely no pregnancy has happened. So that's a sign of male infertility. So I hope you enjoyed this short video on the different signs of male infertility. Please do share it with all your friends and loved ones. It may be useful to them. Do comment, like, and subscribe. This is Dr. Shah. Stay healthy and stay happy.